Great. Good morning or good afternoon, evening, wherever you're joining from. Many of you know me, but my name is Amy Savage and I work in the Climate Change and Health Unit here at WHO headquarters. And I'm really pleased to welcome you to another of our webinars in our Climate Change and Health Technical Webinar series. Today, we will be discussing the WHO operational framework for building climate resilient and low carbon health systems. Many of you are probably familiar with this practical tool that we originally published in 2014, and we've just recently updated and republished in 2023. So it's a really critical tool, and it also sets the foundation for some of our future webinars. But before we start, as always, there's a little bit of housekeeping. So as with the other webinars, we do have two sessions. I'm just going to share my screen. So that you can see here the two times that we have. We have this morning, 9:30 Geneva time, and then we have another session this afternoon at 3 p.m. Geneva time. If you are attending this session this morning, it's the same content, so no need to attend this afternoon. And for anyone who can't make it, your colleagues, we will be recording the sessions and putting them on the WHO website. Here's the schedule of the upcoming webinars. So the next one we have will be developing a Health National Adaptation Plan in June, just an introduction to that process. You can click the QR or scan the QR code and find the full schedule. It's on the website as well. But please do let us know if there are any topics in this schedule that you think are missing or something you'd like to cover. We're really happy to add another topic and cover the topics that are of interest to you. So in this morning's session, we do have simultaneous interpretation. We have French and Arabic, and this afternoon we will have French and Spanish. So if you are using the interpretation, just have a look at the instructions on the screen here and go ahead and set that up. So we have set this up, as with the other webinars, as a meeting rather than a webinar in Zoom, and that's so that we can have some engagement and discussion, and particularly in the breakout sessions that we'll have later. It does mean that there are quite a lot of people here, and so we ask you to stay muted when you're not speaking. Also, feel free to use the chat and the Q&A functions, and we will endeavour to answer your questions during the session or follow up as needed later. So as I mentioned, we are recording the session and we'll put it on the website after the session finishes. So here's the agenda of what we'll be covering today. In a moment, we'll hear from Dr. Diarmid Campbell-Lendrum, the head of the Climate Change and Health Unit at WHO, for some opening remarks. Then we'll hand over to Elena Villalobos Prats, who is the lead for country support and capacity building here at WHO, and she'll present the content on the operational framework. We'll then hear from some colleagues, Dr. Meelan Thondoo from the WHO Asia Pacific Center for Environment and Health in the Western Pacific region, and Dr. Bonifacio Magitibay, who is from the Philippines country office, and they'll share their experiences with the implementation of the operational framework. And we'll finally have the opportunity to break out into an interactive activity, discuss the operational framework and how we might be able to use it in our different contexts, feedback in smaller groups, and then we'll summarize and close the webinar. So with that, I'm really happy to hand over to Diarmid Campbell-Lendrum for the opening remarks. Thank you.
Thanks so much, Amy, and thanks to everybody who's joined this session in what we think is a really important technical webinar series. And that's partly the importance of the issue overall. You will be aware that WHO has been talking about the critical importance of climate change and health for many, many years, but it's being absolutely elevated to the top of the global public health agenda now. We're coming up to our World Health Assembly in about 2 weeks' time, where there will be the first World Health Assembly resolution on climate change and health for 16 years, which is elevating this issue. And we're also publishing WHO's general program of work for covering the next 5 years, which is our health agenda, but it's also the health agenda for the world as a whole, not just for WHO as a secretariat, but for all of our member states. And many of you will be aware that we are elevating climate change and health to be the first of the 6 priorities that we're identifying for global public health for the next 5 years. So this is absolutely top of the agenda. And just to emphasize the importance of this particular webinar and this particular guidance document and process and approach, our operational framework, because this is probably the most important guiding document that we have. So as WHO started to run health adaptation projects from about 2010 onwards in different countries around the world, dealing with different climate threats to health, we gathered a lot of experience, but it's always been a challenge to address the wide range of health impacts that climate change can cause in a single framework, in a single approach. And it was a real breakthrough for us when we, in consultation with the people who had worked on this issue, in consultation with our countries, we were able to pull this together in the first operational framework for building climate resilient health systems, as it was in 2014, 2015, when we published this document, because it made that wide range of health threats intelligible and mapped them on to the core business of health systems. So it made it possible for us to talk directly to a national health system, for them to understand what we're trying to do and have everything that we're trying to do in climate change mapped onto their core building blocks of health systems. So it was a real breakthrough for us. And then it's also been a real breakthrough to publish the update of this document last year, to marry what we've been promoting on building resilience to climate risks with the new drive and interest that we see, that we've been promoting and that we see reflected back to us from member states and other partners, for health systems also to do their bit in reducing carbon emissions, because they're a significant contributor to global carbon emissions. So the operational framework is the approach and the structure that allows us to make sense of all of that in quite a simple way. And then, as you will hear from Elena and others, that's the skeleton, if you like, in which we can we add on all of our more detailed approaches and technical products in different domains. So I just wanted to join the meeting just to emphasize the importance of the issue, and particularly this guidance document and this approach. So I'll look forward to the rest of the discussions, and with that I'll hand directly over to Elena. Over to you, Elena.
Thanks so much, Diarmid, for this very important introduction. Let me share my screen, and then I will start running through the presentation, through the slides. Can you confirm that you can see my screen?
We can see it, not yet in presentation mode.
Perfect.
Yep.
Should be fine. Thank you, Amy. Basically, let me just go directly to the slides. Just for you to know, this is part of a package of trainings that were developed and launched this year. And as Diarmid mentioned, this is probably the most important tool that we have to support countries start working on climate change and health. By the end of this session, that I will be running for approximately 30 minutes, you will be able to understand the different uses that the operational framework have, as well as the structure, components, building blocks, and specific information that you can find in this guidance document. You will be able to understand key concepts, like, for example, climate resilient health systems, sustainable health systems, understand also which are the different pathways that WHO promotes for countries to promote both climate resilience and low carbon sustainability in an integrated manner. So you will understand that for us, probably the most important concept that countries, and the most important objective that countries should have and health systems should have, is performance, so it's quality of care, and within that, aim to have climate resilient health systems, and of course, depending on where they are in terms of performing, basically they have different opportunities to decrease their own emissions. And then, of course, use this operational framework for different purposes in terms of planning. Now, what we are proposing is just to start hitting the engines is a Slido question. So you can enter either through the website, just with slido.com and then what you see on the screen, or you can use your mobile, scan this code, and then go directly to the question. So I give you just 30 seconds to try and either scan this or enter through the website, and then we can go to the specific question itself. So this is the question. How familiar are you with the WHO operational framework for building climate resilient and low carbon health systems? So you can start responding, and we see, I think there are already 27 people, 29 people on the poll. So please let us know whether you are familiar, not familiar, somehow familiar, or highly familiar. Perfect. We see the results. 30% of the participants are not familiar at all with the operational framework, which is great. 45% somehow familiar, okay, and then 11% familiar. What you see in this screen now is basically what we call the causal pathway from climate change, and how from different exposure pathways, vulnerability factors, and hazards, we get different health outcomes and also outcomes at health systems and healthcare facility level. Something that is evident now is that the health impacts from climate change are quite wide in range. And they go from direct impacts, for example, those posed by extreme weather events related to injury and mortality, also those related to heat stress. But there are other health risks that are mediated through changes in specific exposure pathways like vectors, like everything related to vector-borne diseases, not only from mosquitoes, but in some cases even rats. There are also those related to changes in the water quality or water availability that population use. And there are also those related to malnutrition and foodborne diseases. Something that we see when we work with countries is that as countries start to think about climate change and health, everything related to infectious diseases and direct impacts on healthcare facilities are quite easily understood. But as countries start to do more and more with regards to climate change and health, they become more aware of different impacts, like, for example, those related to mental health. In terms of definitions, what we consider a climate resilient health system. So basically, a climate resilient health system is that is able to anticipate, respond to, coping with, recovering from, and adapting to climate-related shocks and stress, to bring about sustained improvements in population health despite an unstable climate. Something that from WHO is very important is to understand that climate change is not only about extreme weather events, like, again, heat stress, flooding, cyclones, extreme rainfall, but it's also everything related to long-term climate change, like, for example, sea level rise, drought, and the increase in temperature that is not stopping. With regards to low carbon sustainability, and as Diarmid said, this is the new addition that we did to the reviewed operational framework that we launched last year, is basically those systems that consider mechanisms and ways for them to reduce their greenhouse gas emissions. So even if the title refers to carbon, we consider that the whole greenhouse gas emissions should be considered by health systems, and then also reduce everything related to the environmental impact of health systems. So in this case, you can think about, for example, land use, water use. So everything for us is included into this definition. When it goes to resilience, there are specific approaches that countries will need to implement. So for example, of course, they will need to manage the climate-related health risk. You saw in one of the previous slides that risk is composed of vulnerability factors at population, community, health system level. And for example, those are related to geographical considerations, so whether or not health systems and populations are exposed, but also more social factors and gender factors that will determine the vulnerability of specific groups and individuals to the specific risk. But also this risk is composed of the exposure pathway and then the specific hazards that are going to be present in the specific context. Then you will need to increase the capacity of health systems, and we will go into more detail on that. So depending on the performing capacity and the capacities overall that the health system has to recognize, monitor, anticipate, and communicate about climate-related health risks, you will need to focus on specific capacities for those to be strengthened. And then, as per my previous comment, you will have to have a long-term vision and adaptive management. So it's not about getting ready for the imminent extreme weather events, but it's really about understanding how the different risks will determine everything that you do with your health system, from designing new facilities and where to locate those, to really understand how you will need to inform the management and the delivery of specific climate-sensitive disease programs like malaria, undernutrition, and so forth, environmental health. And of course, you will need to apply this climate-resilient approach to health systems. This is basically how we depict the resilient in health systems. What you can see on the left side is basically the capacity of your health system. Then you have the time frame. And what you can see there is the representation in the middle of risk. As I mentioned before, is vulnerability, hazard, and exposure. So basically, when you are exposed to the shock or to the stress, you will have specific time to respond to this shock or stress, and then hopefully you will be able to continue working as before. And of course, in some cases, you will be able to recover better than before, even to transform. That is hopefully what happened with COVID. Health systems collapse, but then I think they have started to strengthen their capacities to deal with similar shocks. So we can create a parallelism with climate change. And then basically, in some cases, health systems will collapse due to a extreme weather event or to an outbreak of a specific climate-sensitive diseases like cholera, dengue. We are seeing the increase in dengue in many countries. But in some cases, they will manage to learn and adapt to these outbreaks and get ready for the next one. At the same time, that is important to strengthen the climate resilience of health systems. Of course, we realize that health systems are also contributing to the problem, to climate change, because they have greenhouse gas emissions, which are quite significant. So basically, the global estimates determine that between 4.7 and 5.2 of the global greenhouse gas emissions are coming globally, are coming from health systems. And what you see there is the contribution of different sectors to the emissions from the NHS England as of 2019. Something that is quite shocking is that most of the emissions are coming from the supply chain. So this is not to say that the health sector should compromise the quality of care that they provide to decrease their own emissions, because of course the first priority of health systems is to protect the health of the populations and to provide the services that they will require to keep the highest level of health. But while providing this care, they have opportunities to reduce these emissions as much as possible. This is the conceptual framework for low carbon health systems and healthcare facilities. And basically what you can see in the scope is how there are different scopes. Scope 1 related, I'm sorry, because I think the quality of the image is not very good. I'm not sure you can read everything. But basically, scope 1, it relates to direct emissions, like everything related to what is happening at healthcare facility level, no? Like the management of the waste and recycling. Scope 2 is everything related to indirect emissions and purchase energy. And then scope 3 is related to supply chain. What you can see on the top of this slide is basically the top-down approach. Basically, what emissions that can be controlled at national level, health system level. In some cases, this is not possible because there are some countries which are quite decentralized. But for countries that have a strong national health system with, for example, decisions to be taken in the products that they buy or in the energy that they buy, then there is some opportunities for national health systems to decrease their emissions. And then what you see on the top, on the bottom and green part of this slide is basically the bottom-up, which is really the opportunities for healthcare facilities specifically to reduce the emissions coming from these different scopes at their specific level. When it goes to the operational framework, there are different uses, and basically we have been using this, and countries have been using this for example, developing comprehensive health national adaptation plans, or the health component of national adaptation plans, the health chapter. We have also seen this operational framework used as part of the climate change and health vulnerability and adaptation assessment, as you know, and if you joined the previous webinars, there is a part there on the vulnerability and adaptation assessment when where countries or specific contexts needs to assess the capacity of health systems. So basically this structure, the 10 components, can be used to assess this capacity of health systems to deal with increased health risks from climate change. We have also seen this operational framework used by countries, and also WHO uses it, to develop either investment cases for climate change and health, aiming to strengthen the climate resilience and low carbon sustainability of health systems. And also, this has been used, for example, by the Green Climate Fund to develop their sectoral guidance on health. As Amy mentioned before, what is new in this version that we launched last year is basically that we integrated in a comprehensive manner both resilience and low carbon sustainability to the version that we launched in 2015. And why we have done this? Because we think that both resilience and low carbon sustainability should be promoted in an integrated manner. We don't want to promote different approaches or silo approaches in the work that countries are doing, because there are opportunities for them to integrate both low carbon sustainability and resilience in the same manner. And an example of this is, for example, energy, increasing access to energy from solar. So when countries and healthcare facilities have access to solar energy, they are not only becoming resilient to climate change, because they will not rely in a grid that can basically be destroyed with extreme weather events, but they will also reduce the emissions by doing so. This is probably a very important concept that we introduced in this integrated approach that is looking to both resilience and low carbon sustainability. What you can see there is basically an attempt that we did to put together, to consider at the same time health system performance, and for that we use as a proxy the Universal Health Coverage Index with the emissions and the data that we have. As you see, there is not many data points, unfortunately, but basically we compare those. And then we see that there are specific national health systems that very high performing, what you can see in this green square on the top with 2050, and that they have also low emissions, but unfortunately also there are countries that are not performing very well in terms of health systems because they have less capacity and they need to continue strengthening their health systems, and at the same time they don't have many emissions. So what this means? Basically that in some cases, those countries that are not responsible for many greenhouse gas emissions and that are not performing very well, they will need in some cases to continue increasing their emissions, for example, ensuring access to basic services like water, sanitation, energy, or even technologies that they don't have because they are not able to purchase the technologies that they will need in health systems to be able to protect and promote the health of their populations. So in some cases, they will need to increase their emissions, but hopefully by 2050, while focusing on climate resilience and adopting some technologies that hopefully will be lower in emissions, maybe, hopefully, in 2050, they will be able to become climate resilient and provide the quality of care that they need, while at the same time reducing their emissions. Those countries that are performing very well and that have very high emissions will have to move quickly to the greener side and focus on reducing their emissions, even net zero emissions, while keeping and continuing to provide the quality of care that they are providing. So this is an approach that we are promoting at country level, and that is very important also in terms of equity. Something that we realized already in the first operational framework that we launched in 2015 is that countries understood very well that the health systems building blocks language. So basically, we continue in this new version to build on these building blocks that you see there. And we basically provided 10 components that, if implemented at country level, will basically allow countries and health systems to become climate resilient and low carbon sustainable. The first component is climate transformative leadership and governance. For each of the components that you will find in the operational framework, there are objectives. So basically, the objective of this leadership and governance are, of course, governance, policy development, and cross-sectoral collaboration. And for each of these objectives, we provide specific examples of interventions that can be implemented at country level for this specific component. So with regards to climate transformative leadership and governance, of course, we think it's vital for countries to have climate change and health focal points at the Ministry of Health, at least, if not specific units looking at climate change and health. When you have specific units, and it's the same in WHO, we cannot work in a silo. These focal points or these units will have to work very closely with all the climate-sensitive health programs and with the different functions, for example, finance, surveillance, DHIS at national level, to be able to integrate climate change and health considerations and to be able to address the risk that countries have identified. Something that is also very important is to work with other sectors. So, for example, developing healthy nationally determined contributions. As you know, countries implementing the United Nations Framework Convention on Climate Change are expected to develop nationally determined contributions, which is basically their commitments to reduce emissions in their specific sector, in specific sectors. That can be energy generation, transport, urban planning. So basically, while doing that, the health sector should be ready to work with these other sectors that are also most responsible for the emissions and help them to identify and to promote which are those interventions to be implemented by them, for example, in the water, sanitation, transport sector, that will be accompanied by the major health gains. So it's not the same to develop or to construct another road than to promote healthy and active transport ways like cycling and so forth. My colleagues tell me that I'm quite slow. I need to be faster. So I will not go into all the details of the different slides, just for you to understand that the second component is that related to climate smart health workforce. The different objectives is not only about capacity of the health workforce already in place, is also about organizational capacity and ensure that your health system has enough trained health workforce so that they can understand which are the health risks posed by climate change and the opportunities to reduce the emissions. Example, university curricula, professional training. I will not go into details. You will have this assessing of climate and health risks and greenhouse gas emissions. You already, the health risk, the assessment of health risk is basically what you saw in the previous webinar on climate change and health vulnerability and adaptation assessment. Integrated risk monitoring, early warning, and greenhouse gas emission tracking, very important, is research examples. the DNA that I mentioned before, also understanding where the emissions, the greenhouse gas emissions are coming from. For this, you can do more or less sophisticated assessments, even qualitative assessments. But the important thing is for health systems to understand where the emissions are coming from, which are the key hotspots. Could be in supply chain, could be anesthetic gases, could be transport, could be food supply, so that you are able to reduce this. Could be waste management practices. Something that is very important and that WHO promotes in every project and program that we implement at country level is climate-informed health surveillance. So at the minimum, countries will be able to use climate and weather information to understand risk and, for example, do risk mapping. When data is of better quality, when data is available for long period of time, countries will manage to even create health early warning systems, meaning that they will be able to predict the risk of specific outbreaks occurring. And I think you will have all the examples. Something that is also very important is climate resilient and low carbon infrastructure, technologies, and supply chain. So for these objectives is the promotion of new technologies, environmental sustainability of health operations, and adaptation of current infrastructures, technologies, and supply. You will have case studies here. Component 7, monitoring, regulatory mechanism, and cross-sectoral climate-informed health programs. This is very important. Of course, everything, all the information that countries and health systems will gather under the health information pillar, basically the vulnerability and adaptation assessment, the integrated surveillance, and the research, should be used basically to inform the way health programs are delivered. Emergency preparedness and management, everything related to extreme weather events and how countries deal with this increased risk, and examples of interventions. One of the components is also the management of environmental hazards and risks. So basically, specific interventions that countries can implement is everything related to climate resilient water safety plan, climate resilient sanitation safety plans, climate resilient and low carbon sustainable healthcare facilities, changing the way the malaria program delivers its services. So, for example, providing bed nets in places where before malaria was not present, and then, of course, health sector contingency plans. Financing, this is probably a key priority by countries. So there should be opportunities for countries to access climate finance, and for that we help them. Also health finance to integrate climate change and health. And then, of course, being able to access funding and finance from health determining sectors finance. Example of interventions, of course, having domestic budget allocated to climate change and health, and also being able to develop climate change and health projects to be submitted to either the Green Climate Fund, the Global Environment Facility, the Adaptation Fund, or bilateral donors. And for this, WHO can help you. Of course, if you want more information, please feel free to contact us. And just to also mention that we have a specific guidance to help countries to measure when they are advancing on climate resilience in health systems. This is a priority by many countries, and we are aiming to do more. We can provide the further information because this is also a priority for WHO in the next global program of work that will be implemented, as Diarmid mentioned. Measuring climate resilience and low carbon sustainability will be part of overall across WHO efforts to work on climate change and health. So as Diarmid mentioned also, we have tools to support countries to do everything included in the operational framework. So again, you will have this and you can come back to us if you need further guidance. This is it from my side. Thanks so much.
Thanks so much, Elena. And maybe next time we need a little bit more time to go into the detail, but we will also have an opportunity to look at some of the specific components as we go into the breakout rooms. But now I'm really pleased to welcome Dr. Meelan Thondoo, who will be looking at some of the work that's happening in ACE. So Dr. Meelan.
Thank you very much, Amy. Just give me 1 second. I'll open now.
I think, Elena, you have to stop sharing.
Thank you. It's lovely to be here, and I can see that the participants have really grown, so I'll just start sharing my screen. Okay, so can you hear me and can you see my screen clearly?
Yes, perfect.
Great, thank you. Well, thank you very much for the team at HQ for putting together these very informative sessions. I'm super excited to be here and hearing from all of you. So for the next 7 minutes, I'll be talking about different implementation gaps regarding climate resilient and low carbon health systems in the region of the Western Pacific. So I set my timer now. This work is part of the Asia Pacific Center for Environment and Health in the Western Pacific region. As you can see, we have quite a large portfolio across 4 different streams, but I would like to highlight that a lot of this work has been done in collaboration with the University of Melbourne. They've been really strategic for us to be able to run some operations regarding this scoping review. ACE is functions as an operational arm for the region as well, and it would be really nice if you wanted to have a look at what the office does. Maybe a quick couple of notes on the context of the Western Pacific region. This is a hot topic. Last month, there was excessive heat in the region. You can see here somebody spraying off, but more importantly, it increased heat-related deaths in the region. There is quite a lot to learn from a region that's very diverse with a lot of potential, particularly regarding the amount of small island developing states, but also the diversity and burden of disease and the bioregions. You can see here that nearly over 90% of the people who die in the region are actually dying from environmental risk factors, including air pollution, non-optimal temperatures, and occupational risks. But mostly what we see is these burden of deaths do vary based on the climate profiles of the different countries. The region doesn't differ much from global trends. You can see here that it still follows the trends in increasing deaths related to heat. It's also following trends in the increasing number of droughts over the globe. You can see that in our region, there is quite a lot of red as well. But maybe 2 points that you might not know is that nearly 30% of all people who are dying in the region are dying from floods and storms. And the second thing that you might not know is that every 14th second, 1 person dies of air pollution, really kind of triggering our attention towards thinking of the different effects of climate change and poor air quality and how these are worsened over the different pathways that Elena has explained to us. Moving along with the topic of today, health systems then have 2 responsibilities. First, they have to provide care while decreasing their footprint. And this is quite difficult. As you can see on this slide, the emissions from health systems can vary greatly. If you look at the particular region of the Western Pacific, there is a bit more of dark blue showing that there's higher emissions than other regions of the world. Really kind of making us think right now, what are the different steps that we will need to take to be able to have steps and interventions that would help health systems to continue performing while decreasing their footprint. As Elena and Diarmid have showed, there are an increasing amount of resources and tools that enable countries and different counterparts to focus on the performance and the decarbonization of their health systems. And for us to better understand the status of affairs in the Western Pacific region, what we decided to do in collaboration with the University of Melbourne was the scoping review. I hope you'll find it interesting, and I think that, Elena, you've made my work really easy here because you've really gone through all the components. The main aim of this scoping review was to first gather evidence on where are these interventions happening, how are they happening, what are the different outcomes of those interventions, and then second, to really investigate whether or not they're aligned with the WHO framework, whether they comply with the different components, and whether there were or not implementation gaps. So for this, we looked at 6 countries in particular, and my colleague from the Philippines will give us a bit more detail about the Philippine experience. But in this case, we focused on implemented interventions in Australia, Fiji, Laos, Mongolia, South Korea, and Vietnam. So a rapid scoping review method was used. We looked at grey literature, but also peer-reviewed literature across different databases. We selected a date range that started from the publication in 2014-15 to the more recently updated framework in 2023. And yeah, we're quite excited to show you what we found. So you can see here on the left the building blocks of health systems, and then the healthcare facilities guidance on the right that has been merged to cover both resilience and lower carbon. We extracted 43 case studies from a pool of 605 documents. And as a descriptive overview, I would highlight here that most of the documents were identified from grey literature. You can see that there were peaks in publication from 2015 and 2020 into 2022. Most of the interventions were implemented at healthcare facilities level, with a high rate of interventions reported from Australia, followed by Vietnam, Fiji, Laos, Mongolia, South Korea, then Mongolia. So the way that we went about analyzing those interventions was to use the operational framework. So as I said before, the 10 components of the health system's building blocks for the interventions that were more focused on climate resilience. And then for those that were more focused on lower carbon, we used the 4 fundamental requirements of the healthcare facility guidance and the standards to manage carbon footprint. And what we found was this. Most of the interventions actually focus on lower carbon pathways through environmental sustainability and decarbonization. And 20% of the interventions focused on climate resilience. And as you can see here, there was quite a part of that pool that focused on both, that were synergistic. Maybe to give you a bit of examples here, examples of interventions for climate resilience included water safety plans, adoption of sustainable waste management in Laos and Fiji, for instance, solar power installations, whereas interventions for lower carbon pathways focused on energy supply and use. So for the last part of my presentation, what I'd like to show you a bit more, and I'll take 1 more minute, is how this is mapped on the framework. So you can see here that there was quite a lot focusing on climate resilient and low carbon infrastructure, followed by these 4 other components. Now, there was quite a gap in sustainable climate and health financing and climate-related emergency and preparedness. Looking at the fundamental requirements for healthcare facilities, there was a lot going on in water sanitation, hygiene, and healthcare waste, and a lot less in infrastructure technologies and products. But what we did see is that most of the approaches were bottom-up, and a lot of the interventions actually focused on Scope 3 emissions. The last thing that we looked at was whether or not these interventions were evaluated, 53% of which were or the prevalence of outcome over process indicators. There was a lot of interventions that were evaluated using GHG emission counts. And 70% of those interventions reported on different types of gains: economic, health, social, quality. There was a lot of barriers and enablers reported in the interventions, including lack of resources, capacity, staff engagement, but also the real need of having more mandatory reporting and education and communication around the topic. To wrap up my presentation, here is a quick summary. There was a geographic bias towards Australia. Majority of interventions focused on lower carbon pathways with scope 3 lower carbon activities. Community engagement emerged as a potential driver for strengthening health systems, and costs were rarely reported. As take-home messages, there is a need for more evidence about how practical application of the framework works. We need more real-life experiences from the implementation of interventions across different areas of action, as we can see here. And finally, there's a real need to shift from more fragmented approaches of mitigation towards more comprehensive system-wide strategies, taking into account policies, assessments, capacity building, and different types of governance infrastructure needed. So this is it on my side, and I would like to highlight again that this work has been a collaboration between a lot of people on the team, including at ACE, at the University of Melbourne, with the support of the regional office. So thank you very much.
Thanks so much, Meelan. Really interesting to see what's happening in the Western Pacific region. And we're a little bit behind time, so I'm going to just hand straight over to our colleague, Dr. Bonifacio Magitibay from the WHO Philippines Country Office. Bonnie?
Yes, Ami, I could not share my slide. I think I was blocked to to share my slide. So please allow me to share my slide.
Okay, try now.
All right. Okay. So
Great.
can you see my slide?
Yes, it's not in present. Yes, now it's great. Thanks.
All right, so good. So thanks, Amy. And good day, everyone. I'm Bonnie Magitibay. I'm the Technical Officer for Environmental Health at WHO Country Office in the Philippines. I'll be sharing with you how the Philippines responded to the WHO operational framework on climate resilient and low carbon health systems. As previously presented by Elena and Meelan, WHO operational framework has 10 components. In response to this, the Philippines has already some activities that are completed, ongoing, and proposed, as there are evolving national policies relevant to climate change and health. There are laws, policies, plans, guidelines, and tools that the Philippines develop which serve as enablers for adopting the operational framework. Going to the details, I'll highlight the components where the Philippines is strong and on the elements that are, or components that are very challenging or needs strengthening. So for this slide on leadership and governance, this is very challenging. A climate change unit was established in the past, but it did not last long due to the ad hoc nature of the designation. At present, it is being handled by the Health Emergency Management Bureau of the Department of Health, hoping that the merging of climate change and disaster risk reduction, which they are handling, can make a difference. An old policy on climate change adaptation needs to be updated to incorporate low carbon strategies that were mentioned in the Green Manual and in the operational framework. The health workforce is also very challenging with limited staff handling climate change and health. Its smooth operation will be limited. Although there are trainings that are being supported currently by development partners like WHO, UNICEF, and Asian Development Bank, and through the Department of Health Academy, its sustainability is unclear unless there is a responsible office that will manage capacity building initiatives. In the next slide, components 3, 4, and 5 on vulnerability assessment, monitoring, and research needs. This component needs strengthening, as some related activities were conducted 12 years ago and would need review and updating. For the next slide, components 6, 7, and 8 are quite strong. because the Department of Health has a green manual already that covers climate resilient and sustainable technologies and infrastructures. Interventions for environmental determinants are well described in the green manual, in the healthcare waste management manual, in the water and sanitation for health facility improvement tool or WashFit, and we have this National Environmental Health Action Plan up to year 2030. All these tools are addressing the environmental determinants of health. Some health programs such as environmental health, maternal and child health, mental health, One Health, and health emergency have started to consider the effects of climate change that need to be addressed. Examples are the wash and solar energy projects, inverting facilities which we piloted in one province in the country. Health services in birthing facilities should not be disrupted. Thus, electricity and water basically should be available at all times. The next slide, components 9 and 10, are also somewhat strong. The current administration priority include health emergency and climate change. The Health Emergency Bureau of the Department of Health is now leading the health and climate change initiatives. This is better than before, as there are now dedicated staff to handle climate change and health. Although this arrangement is still ad hoc, it may still change in the future. On the funding concerns, the General Appropriation Act is allocating yearly budget for the greening of healthcare facilities. This is in addition to the loans and grant assistance being facilitated by the Department of Finance of the government. Summarizing the key issues, it will revolve on the unstable ad hoc status of designated focal office on handling climate change, followed by inadequate staff. To resolve this, DOH should create an office to handle climate change and health activities with adequate staff and budget for its operation. For fragmented government policies on climate resilience and environmental sustainability concerns, it is suggested to develop a roadmap and an operational plan to ensure implementation of the key elements as indicated in the updated framework of 2023 published by WHO. Updating the existing policy on climate change adaptation is also needed to accommodate current developments and issues on climate change. So that's all for my presentation. Thank you for listening, and I'm happy to answer your questions. Back to you, Ami.
Thanks so much, Bonnie. That was really useful to see how the operational framework is being used in the Philippines and some of the challenges that you've had, but also how you've overcome them. I'm sure there'll be some questions about your experience. So if you stop sharing a screen, Bonnie, I'm just going to share a slide. We've now come to the part of the agenda that is the interactive section. Just bear with me one moment. Okay, so we have 4 breakout rooms. These will be facilitated breakout rooms. Now, the way that Zoom works, we are unable to have the simultaneous interpretation in the actual breakout rooms. So we have one of the rooms will be here in the main room. If you need the French or Arabic interpretation, stay here in the main room, and Elena will be facilitating this session. Each of the breakout rooms you'll see here on the screen will be looking at different components and just delving a little bit more into those specific components and how you might be able to implement those in your context, and then linking to the broader operational framework. So now my colleague Itchy will open the breakout rooms. You can select whichever breakout room you're interested in attending. I'll be working with Jamboard. We'll post a link for each of the Jamboards. So when you're ready, select your breakout room and we'll move into the discussion and the group work in the main room. So I'll hand over to Elena to facilitate the feedback session. We only have a really short amount of time, so it'll probably be about 1 or 2 minutes per person, just to feedback on what the key discussion points were.
Perfect. So can we have a volunteer to report back from any of the groups? Honest?
Yeah, okay. Yeah, thank you, Elena. I'm not sure which group was my team, probably group 1. So let's call it group 1. So from group one, we are trying to look at the challenges that are related to climate and health risks, but also challenges related to assessment of climate and health risks. I mean, integration of risk monitoring, but also research, health and climate research. So from the assessment of climate and the health risks, we came up with a number of challenges. And here, just to summarize a few of them, included lack of political will to support issues or interventions related to climate change and health, but also there has been lack of baseline assessment as to what level the health sector of the particular country has been vulnerable to a number of factors, but also lack of capacity building, as we have seen from the score that Helena presented. You could see still many countries does not cannot be able to relate the importance of low emission and the related consequences in the health sector. So I think the issue of capacity building should be taken very as key point, key component in the overall undertaking or implementation or adaptation measures. But also there has been lack of not only data utilization, but also the assessment tools, the standardized assessment tools have not been there with us, and therefore it is very difficult to conduct a very comprehensive sort of assessment due to lack of assessment tools. But also there has been a lack of climate information, and this is related to weather patterns. Sometimes we miss up the weather data from our meteorological authorities, and therefore it is very difficult also to decide or to plan for the related climate change and health. But also for the area of integrated risk monitoring, the issue of collaboration has been very challenging between sector and sector. Climate change is cross-cutting, and therefore the health sector should work very closely with the environment sector, but also with water sector, agriculture sector, etc., etc. As a health sector, we are advocating much on nutrition, but we depend much on the agriculture sector. So the issue of collaboration here, I think, need to be worked very well. The other thing under the integrated risk monitoring is the disease surveillance issue. We are currently lacking of the climate information related to climate sensitive disease outbreak, and here I think without surveillance, then it's very difficult to identify which diseases are more prevailing in a particular area in relation to climate change and health. But also the tracking of specific information or measures that are necessary to prevent specific whatever challenges or problems. And when it comes to the issue of health and climate research, we came to identify several challenges, including research on appropriate technologies for solution to work up on this solution for adaptation measures, but also lack of cross-national and global research on particular aspects. Like as we are speaking, we have heard the information or presentation from the Western Pacific, but you will see the research or the information which we are presented, we are rather skewed to Australia and probably could not touch Africa as such. But also,
honest. Unfortunately, we will need to keep it there. The report.
Okay, I'm closing.
It was great. Thanks so much. I think it has been very comprehensive, and I can see that the level of discussion that you had in your group is quite impressive. Can I call on Khadija Saidi to also report back on the discussions? If you can keep the reporting to just 1 minute, please.
Thank you very much, Elena. I'll try to keep it under 1 minute. So in group 3, we did have rich discussions from Ghana, India, all over the world on climate transformative leadership and governance, as well as climate smart health workforce. Just to give some of the priority interventions that were highlighted, this include having the political will in the leadership to prioritize climate interventions and ring-fence funds, as well as having a dedicated climate change and health unit in the Ministry of Health, so that they can guide policy development and actions. And also there was a point on decentralizing these actions from the national level to the subnational levels, ensuring that there's standardized communication right from the national to the subnational levels. And then lastly, one other point that was discussed is having a multi-sectoral, multi-stakeholder approach, that is whole of government, whole of society approach in addressing climate resilience, so that it's not just a Ministry of Health imperative, but a whole of government and whole society approach. We did not have enough time to look deep into the climate smart health workforce, but I can transition to the challenges around capacity building of the health workforce. How sustainable are the interventions that we are implementing right now in terms of capacity building? Is this just a one-time thing, or are we investing for long-term approaches? And then another challenge is looking at the funds that are available for climate health resilience. One of the presenters did talk about perspectives from Ghana, where most of the funding or the work that is being done is led by external stakeholders, NGOs. But when it comes to the central level, there doesn't seem to be comparable intervention or investment in terms of financing for climate resilience. So advocating for diversifying of finances for climate resilience, but particularly for domestic finances. So I've just tried to summarize as much as possible in light of the time that we have, but that is some of our discussions from group 3. Thank you.
Thank you very much, Khadija. I think that was very, very useful. Can I invite now Ichi to report back?
Yes. So we had the component 9, which was on component 6, climate resilient low carbon infrastructure, technology and supply chain, which was facilitated by Carlos. And we had a small group of participants, but for that a very proactive discussion and a lot of feedback on the Jamboards. Just to quickly report back what the participants have noted. So they're on infrastructure. There's been a lot of mentioning of using the green building code and using the zero emissions hospital guidelines. On technology, conducting energy audits, doing video consultation, using telehealth more, and also evaluating environmental impacts of new technologies. Also a lot on supply chains, with many participants mentioning the importance of reducing plastics and avoiding or prohibiting the use of single-use plastics, and extending producer responsibility and green procurement. And considering the linkages with the other component, of course, linkages were found with all the other building blocks and components. I'm just going to mention a couple. That leadership is very important, so that green procurement can be facilitated, and also financing to build infrastructure, and also that assessment forms a basis to choose the right technology. So thank you, everyone. And yeah, over back to Elena.
Thanks so much, Itzi. And then last but not least, our hero, Shusma, from the group that I was facilitating, for kindly volunteering to report back. Shusma.
Okay, thank you. Yeah, very fast. We had 3 components: management of environment determinants, component climate-informed health programs, and component 9, climate-related emergency preparedness and management. So I'll go by order. In the first, in component 7, we discussed about developing relevant policies and guidelines and plans, and also provision of adequate environment monitoring tools, which is very important. We also discussed about standardization of, standardizing national equalities, regulations, and aligning them with health-based recommendations. Promoting innovative partnerships also was one of the discussions. Apart from that, coordination and defining monitoring indicator mechanisms for data and sharing purposes. An important part of this discussion was adopting indigenous practices as well. Moving on to component 8, we discussed about the surveillance systems and their linkages with the meteorological systems. Also further in monitoring of equality of various technological innovations linked with incentives. Repeatedly, there's a lot of discussion on capacity building of workforce. Then we spoke about the climate-informed planning as well. Yeah, and then moving on to the last one, we discussed about capacity building of health workers, strengthening workforce capacity, operational preparedness of health facilities, positioning supply or strengthening supply chain, some discussions on legal frameworks, community risk communication, and community engagement, and also communicating impending climate emergencies with community or hospitals. Yeah, I think that's the overall discussions we had across the 3 components. Thank you. Over to you, Elena.
Thanks so much, Sushma Busal. I think we are late, so I will not go into a summary of everything that we've discussed. I think our rapporteurs did already a great job. Probably just to finish by referring back to the comment by Diarmid at the beginning, basically this is probably the most important tool that WHO has to support countries start addressing the challenges they face with climate change in health systems, but also trying to reduce their emissions. And we didn't have time to go through all the presentation, but please refer back to the guidance itself. You will have the opportunity to go through a wide range of interventions that are proposed under each of the components. And again, you will be best placed to understand which are the ones that should be promoted in your specific context. It could be a health system, could be a health program, could be an NGO, could be a bilateral organization working on the topic. Please, I put the link in the chat. We are finishing the translations to French, Arabic, Spanish. So you will have the opportunity to access those documents in those languages. And with this, I will hand over to my colleague Amy to basically close this meeting. Thanks so much.
Thanks, Elena. And I want to say thank you to all the presenters today. It's been very informative and interesting. And of course, there's still a lot more that we'll need to continue discussing. Just a quick reminder that this is a webinar as part of our technical climate change and health webinar series. The next one is on the 12th of June, developing a health national adaptation plan. And we will be looking again at the operational framework, which can be used to structure a health national adaptation plan. So it's a great opportunity to look at how we can use what we've learned today in a specific context. And we have one more Slido. Now we're out of time, so we'll leave the Slido open. You can scan the QR code, put in this code, the same one as before, and this is the question for today. I want to thank all of you very much for your attention, your participation and engagement in the webinar. Please do feel free to send us any feedback, any questions that you have, and we look forward to seeing you in the next webinar. Thank you very much.